would go to the market, and the children would be there. Dr. Gomez Sanchez Celso is one of the best clinician researchers I've ever seen. And one thing I want to emphasize, especially in this forum, is when we talk about women in medicine, there are women that will guide you. But remember, there are men out there that are very respectful to women and that will encourage you to find the path. Celso Gomez Sanchez is one of those doctors that he's a man, but he has guided me in so many things in my life. And Elise is really a mother figure to me when I was studying here. So since becoming an endocrinologist, then I joined the medical college because I just love teaching, because it's the best way to learn about things. So every day I'm doing inpatient this whole last month, and I learned something new. Every day I'm learning something because I have to go teach it during our rounds. The other thing that was really helpful is everywhere I go, whether I'm at a family wedding, at a birthday party, I was actually at just a gathering for women, Muslim women here in Jefferson City, and we started talking about health and lifestyle. So I have friends and family that reach out to me all the time because there are so many endocrine conditions, especially diabetes and thyroid, that I can help them out with. Okay. Next slide, please. Okay. So when I became an attending, this is 2004. So 2002 to 2004 is a 2-year fellowship program. When I became an attending, I was going to be the one that was going to fix everything. But the best thing that happened was I wanted to teach in a medical college. I was told that it's not, the pay scale actually is very different. So if you're teaching in a university hospital, your pay is much less compared to if you're in a community hospital. There are many reasons for that, which we don't have to talk about. But it really made me what is called a lifelong learner, which I hope all of you will do. Whether you go in a community hospital, it doesn't stop. Whatever field in healthcare you choose to be, you can be a lifelong learner. But me in an academic setting, that's what it was. And then I got to interact with these teachers. So we always talk about teachers, but remember, teachers have to be taught by somebody also. So I have this group of people around me that are always teaching me how to become a better teacher. The other thing is, it's a very humbling experience. So I came from my fellowship. I thought I knew everything. I had done very well in the board exam. My professors had told me, Uzma, you are so good in this. You will do fabulous. And I come here, and within a month, I'm humbled by how much other people know. And you realize very quickly, there's always going to be somebody that's going to be better than you. And then you realize, okay, I don't have to be the best one in the world. I want to be the best one I can be. And I want to have people around me that make me better. The other things, 2 things that are very important. One is patient care. So my patients taught me how to be a better person. Textbooks tell you how to diagnose a condition. But when you've got a real patient in front of you, you cannot open them up like a car and throw them away on the floor and then put them all together again. That's not how you diagnose. You make one test, make a diagnosis, make some, then you go to the next test, confirm the diagnosis, then you go to the next test and establish a treatment plan. So I learned the art of medicine from really the best patients. I have students that tell me patients in my clinic are the best they have ever seen. So they are really, really good. And I also learned from them what I call the art of living. The first thing I learned is just smiling. I had a very fabulous patient who passed away at the age of 86. I was seeing her for diabetes. Every visit she would come. Even if she had just been in the hospital, she would come with makeup and lipstick. And she collected scarves, so she would always have a colorful scarf around her neck. And she dressed up to come visit me. And I always felt better talking to her. I had patients that actually pointed out mistakes in my notes once we got electronic medical records, but very nicely. They told me, you've got the wrong family history in my note. And they didn't blame me for anything. They never said, you are such a bad doctor. So I learned the art of living from these people. And it's really important. I think we are always talking about what textbooks are telling us, or I learned something in a lecture. It's really the patients teaching you as you go along. And then my students. Oh, I'm telling you, today I learned something. I never knew you could make a presentation out of Canva. I had actually used it to make posters and other things before, and I never knew you could make a presentation on it. So one of my students, Alina, teaches me how to make a Canva presentation. Now, you can tell how nicely formatted it is. That is Alina doing it. Mine was all over the place, but that's how you learn. Young people teach me things all the time. All the time they're teaching me something new. Oh, Dr. Khan, we just read this article. Can you tell us about this? Or computers. They're telling me how to do computers, how to take a picture, put it into the electronic medical record. And then my iPhone, whenever it starts dying or something is happening to it, my students tell me what to do with it. So I think a lot of times there should be everybody around you can make you a better person if you just open yourself to it and just say, I am going to learn from everybody around me. Okay, next slide, please. So there are two types of endocrine that you can be. I do what's called general endocrinology. Basically, this deals with the different glands. Most of the time, it's thyroid, parathyroid, pituitary, or adrenal gland. Now, there is diabetes also. And diabetes is about half. In fact, in my case, it's close to half, but in a lot of people, it's 80% of their practice is diabetes. But these glands became the ones that I was more involved with. And my special area of interest is thyroid and parathyroid. So I do what's called thyroid ultrasounds and biopsies, and I pick out these nodules and do little biopsies in them to determine if there's cancer or no cancer. Okay. It also taught me that whenever you're doing anything, a complex endocrine diagnosis, you have to have a multidisciplinary team. You can be the best person to diagnose a thyroid nodule by needle biopsy as thyroid cancer. But if you don't have a good surgeon behind you, the patient is not going to do well. So I have this fabulous group of surgeons around me that go in and they remove all these tumors and stuff. And the patient, I get the credit for it because they come back and say, Dr. Khan, we are doing so much better. And it's actually, I only did the diagnosis. The hard work was done by the surgeon. Okay, next slide, please. Diabetes care is a lot of our practice, and it's becoming more common. And there are many reasons for it. It's not as simple as that, just people are getting obese and eating more. There's much more to the story. We are only now learning about the genetic components and about other things in the environment that might be making an increase in diabetes. But we do know that we have to control the glucose in these patients if we want to make sure they don't get long-term complications. So the best thing is preventing diabetes. And there's a big focus on it. If any of you is interested, you can look into the diabetes prevention program where they talk about how lifestyle and diet can help you prevent diabetes. But once a person has diabetes, we use a glucose meter, a little device to check their blood glucose. It can be either you prick your fingers for it, or you can stick it on your arm like this lady has done, and it will check your blood glucose every 5 minutes under the skin and show it up on a little reader or your iPhone. And then we can treat. We can use insulin, we can use pills, but we are now having so much technology that we are using. And actually, there's a new pump that's going to be coming out where The patient doesn't have to do anything. The pump has a continuous glucose monitor. It talks to the pump. The pump gives the right amount of insulin. So technology one day will hopefully catch up with everything. We are also doing a lot of more genetic testing and finding genetic reasons for diabetes. Whatever you do in healthcare, even if you're not an endocrinologist, whether you decide to become a physical therapist, whether you decide to become a social worker, a nurse, a doctor, whatever you do, you will have to deal with diabetes. So if nothing else, I can tell you today, diabetes is something, it runs all around us. It's in our family, it's in our genes, it's in our family and friends. So we need to, all of us, be very aware of this condition. Next slide, please. So after all of this journey through general endocrine and diabetes, I had always had an interest, even before I became an endocrinologist, in looking at why do we have these disparities that we have in healthcare in general. So around 2016, I applied and they were very surprised because it's like, are you sure you want to do a master's in public health? And I was like, yes, I want to do it. And I completed it, and it gave me such a better understanding. Now, I will probably not be at the CDC at any time, but what this did was it gave me a really good understanding of the disparities we have in health, whether it's related to diabetes and obesity, whether it's related to why is it that patients don't come back for follow-up. So in the inpatient service I did for the last month, I made sure that all those patients that had been lost to follow-up and then ended up in hospital, we had a mechanism to where we could find them and make sure they were followed up. Okay. Then I live in Missouri, which has a big rural population. And you know, the social drivers of health that we have in rural areas are just, we are only now trying to understand them. And we don't think of America as having those problems. We think of Pakistan, the squatter settlement, as having it. But I can tell you, the more you look around, and you all are in Washington, D.C., if you just look in that city, or if you go outside in rural Virginia, you will see these problems over there. There are so many people that cannot afford medications. And we live in the richest country in the world. So it doesn't make sense to me. We also, if you look at it, and I was just looking there, and I think Virginia, West Virginia actually has just about the highest diabetes in the United States, not very far away from you. But it's a poorer state, and that's where people are in coal mining and other things. And you might say, why? This is America. So I think if any of you is thinking of going into public health, there is so much to be done right here in America, right in Washington, D.C. Okay, next slide, please. So now we come back to my experience as a Muslim woman in healthcare. I'm going to put this one word at a time. Let's start from healthcare first. What is healthcare? Healthcare is respect for human life. Doesn't make any difference of the life. So for me, before I say my experience as a Muslim woman, I will say my experience in healthcare. Then you learn to respect the person sitting in front of you. That's the patient, but it can be the patient's family. Then we talk about patience, thankfulness, being just humble in life. And if you think about this, you realize there's not much I can control in life, but I can control myself. That's the only thing I have control over. And then if you move back, in women in healthcare, that becomes a challenge then. So first, healthcare. Learn what it is like you are stepping into healthcare. Then you think of it, I'm going to be a woman. So for me, the biggest challenge as a woman in healthcare was making sure I have enough time for myself and my family. And I took care of my older in-laws who have passed on now, and I'm taking care of my mother who's in her 80s. And then think of yourself as a Muslim. I'm not saying it's not important. This is not in importance. But if you can separate these and then come back to them. So as a Muslim woman in healthcare, everything that Islam teaches me is right there. In fact, sometimes it's surprising. I am not a person that uses a hijab. I miss my namaz quite a few times, and I think sometimes I do what I call my catch up. So I'll be doing the qaza namaz, 2 or 3 of them together. But I read one place many years ago that Allah doesn't need our prayers. He doesn't need our namaz. We do it for ourselves. We don't do it for him. Same applies here. As a Muslim woman in healthcare, I have had experiences where people are so respectful. When I go into any new situation, I actually introduce myself because sometimes people may think I am from another country. They may not realize I'm a Muslim woman from Pakistan. I'll go in there and I always say, I'm Uzma Khan, I am from Pakistan. And I have yet to find an experience where somebody was not respectful to me. I have people that during Ramadan will actually take their food away and try and eat it in a corner. And I have to tell them, no, that's okay. I don't mind it. In fact, it makes me feel very happy that you are eating such good food. So those are the little things. My experience as a Muslim woman in healthcare is whatever Islam teaches me makes me a better woman and a better person in healthcare. So I don't separate that as such. But I do want to hear what your questions are. Because for me, I think just the fact that right in front I put it there, I introduce myself as somebody from Pakistan. And I always talk about my experience related to Islam and different things. And I'm always very open about it. I have never had a negative experience. But maybe, Alina, we can open up. We have a small group, so we can have a discussion. Whoever wants to have their video on would be good. But if you don't, that's fine also.
Yeah, before I open up to the floor, I wanted to ask some couple questions that were sent in before.
Oh, okay.
So what was the one thing that attracted you to the field of endocrinology?
So like I said, when I was in Pakistan, there was no such field as endocrinologist. I knew there was an endocrine, we all read about the endocrine system. So when I came here, the first year, I had 2 rotations, inpatient rotations with Dr. Gomez Sanchez. And he is one of those people that when you present a patient to him, so the way we did our rounds was we would go see the patient and then we would present to the attending. And he never said that any of your management was wrong. I would miss things all the time. I was an intern. I would be missing things all the time. And he would say, Uzma, let's have you look up how to do this. And can you tell me tomorrow how to do this? And this is a person who knows exactly how to do it, by the way. So I would go, and the next day I would tell him, I would say, for this person's blood sugar, I think we should do this, or for high calcium, this is what we should do. And he would say, oh, thank you. This is so helpful. And then I would go, I would take care of the patient, and the patient would just love me. And then I started realizing that there's a big learning curve I have to do. And also because it allows me to talk to the patient. And that's something I did not want to go in a field where I could not talk to a patient. So there were other options, and they're all very good fields, by the way. There is nothing wrong with any of the fields. You're always helping out a patient. But I like to have a room where I'm sitting down with a patient, I'm asking them questions, and then trying to establish a diagnosis. I do have diabetes in my family, but that is not the reason I went. The reason I went into thyroid actually has to do a lot with my family. So I had already decided I was going to be an endocrinologist. I had decided I was going to focus on actually diabetes. That was my area of interest at that time. But during my fellowship, a family member got diagnosed with thyroid cancer, and the management was suboptimal. And I realized that a patient can be very educated, but still get confused by directions that are being given to them, by instructions being given by the surgeon. And you've got a young woman with a cancer diagnosis, and nobody is sitting down with her and explaining to her what's going to happen. And she is planning a pregnancy in the future. Nobody is sitting down with her and talking. So that changed my focus. I started focusing on thyroid cancer and very actively in that area. And whenever I had a new diagnosis of thyroid cancer in my clinic, I always took time to sit down and talk to her. It's just a field that really clicks for me. I love drawing the pituitary thyroid axis or the pituitary adrenal axis. And the patients love it. You explain to them what's going on, and they just love how it's done. Okay.
I really like that. So with the field of endocrinology being so intricate, different types of conditions like diabetes or PCOS, that's really common in women, how do you approach patient education and communication about endocrine conditions?
That's an excellent question, because the condition we know is going to be a chronic condition. So if I have a patient first visit with, let's say PCOS, because it actually is a very common condition, the first thing I do is I confirm the diagnosis, obviously, but then I sit down with the patient and I say, this is a condition you are born with. Because you'll be surprised how many times, whether it's diabetes or thyroid or any other hormonal condition, people tend to think that they did something wrong to cause that condition. And I sit down with them and I say, this is something you were born with. This was going to happen, but we have ways to control it. We have ways where you will not get the complications related to the condition. And I start with one little thing every visit. So every visit, I will emphasize one thing. And then I always say, so what do you think will work? And you'll be surprised how many times a person has a high blood glucose and I figured out everything and it just will not get down. And the patient or a family member will say something. I still remember a grandma. I could not bring her blood glucose down. We brought it down to in the 200s, but I couldn't get it. I tried everything. I would give her medicine. She was on insulin. I was sitting down and talking to her, and her daughter was sitting right next to her. And she says, she watches my children. And she's scared she's going to have a low blood sugar when she's watching my children. So the grandma did not want to have a low blood sugar when she was watching two toddlers. So young children, preschool children, her grandchildren. So I got one of those glucose monitors for her. I said, just stick this on and you will not have a low blood glucose. So you'll be surprised. You sit down, talk. So my approach always has been sitting down, talking to the patient. And I always say we cannot fix this in 1 week, 1 month, or even a year. It will take us time. And in all hormonal conditions, it applies. So that has been my approach in general. I have had times where I have had to spend extra time with patients. And what I do is I make them the last patient of the day or the last patient of the morning, because then I can go into my lunch hour. without having to worry about the 20-minute limitation that we sometimes have on follow-up patients. Okay.
And then, in your opinion, how do you see the role of endocrinologists evolving throughout the next few years, or even with like the technology advancements that you mentioned with AI and everything emerging? So how do you think the role of endocrinologists will change?
So when we talk about diabetes, a lot of it will be related to AI. But when we talk about other conditions, so let's talk about, maybe you have a young man that comes to your clinic, and the young man has a low testosterone level. AI cannot help you in that condition. That also makes me think of, especially when we're talking to a group of young women, that in a field like endocrine, you do have to consider the person in front of you. And you do have to say that I'm going to be taking care of this person, whether it's a male or a female, doesn't make any difference. But in diabetes, AI is going to be a very important thing for us. In fact, I'm looking forward to it, because it's not easy to do a pump setting manually. It's not easy for me as a provider, and it's very hard for patients. So I hope AI will make life easier for young people that have diabetes and old people that have diabetes. Because imagine yourself having to check your blood glucose all the time and then adjust your insulin based on that. And then imagine a machine doing it. I give the example of a stick shift versus an automatic car. So in a stick shift, you have to change all the time, going uphill, downhill in your car. In an automatic car, it does it. You just drive. And now we have driverless cars. So that's what diabetes will become. But for other things in endocrine, we need many endocrinologists. So they are opening up new fellowships in endocrine now, because we have a very big deficiency of endocrinologists in the United States. In other countries, it's even worse, but it's quite bad in the United States.
And then my last question before I open it up to everyone else, what advice would you give to medical students or professionals or even pre-health students interested in pursuing a career in endocrinology?
So I think I would say anybody, and again, this is a group of young people. The biggest thing I would say is learn to touch people. There may be people that may not, at this point in their life where they are feeling sick, they may not be in the best hygiene. They may not be in the best mood. There might be skin lesions they might have. There might be family members around them that are not in a good mood. So you have to become patient, and you have to touch the patient. This would be really important for Muslim women, because we do have this idea that as a woman, there is a boundary, a limit. But when you are the doctor, that boundary, in my mind, does not apply. I would say, if you have a passion for becoming a urologist, you know what? You become a urologist, because I always think to myself, in my life, when I have needed something and I have prayed to Allah, please, Allah, help me with this, it happens. And there's usually somebody that comes or something that happens that my prayers are answered. I sometimes think, when I have patients in my clinic and when they're feeling better, they give me a hug and say, you are the best thing that happened in my life. And I always think that, Allah placed me there. I think it's a blessing that I'm in healthcare. And I touch people, I touch their feet. I was actually one time, a medical student told me, Dr. Khan, how can you touch these feet? This was a person with diabetes whose feet were not in good shape. I said, because I'm the doctor. I have to do it. In men, if they have a testosterone abnormality, they can sometimes get enlargement of their breasts. I examine it. If I have to look at their testes to make sure they don't have a tumor in their testes, I will examine it. I will be very respectful to them. I will have a chaperone in the room also. We use the word chaperone, but it's actually just somebody to make the patient feel comfortable. And when I was having my children in hospital, they all knew I was a Muslim woman. So at a short period of time, there was only a male resident available to examine. And they knew that I was a Muslim person. So he actually came and said, it's time for your examination. And the doctor that was supposed to be coming in is running a little late. I said, not to worry. At this point, you're the doctor. Doesn't make any difference to me. So those are some of the things that I think if you're going in healthcare, you will be dealing with people that are sick. They are not people in their usual state of well-being. It's surprising. We have a very pleasant gentleman in clinic in our service right now who came in with a very low thyroid hormone level. And the first few days, he actually refused to talk to any of us. And even my fellow said, he's not in a good mood. Today, when I was telling him we're going to be changing service and, I'm going off service, he was the most pleasant person. He was saying goodbye, thank you for all your help, because now he's back to baseline. So don't be judgmental of people. Just be patient and be nice to yourself. I think sometimes we forget. It's very hard to have a sick patient that you are wanting to help and you are unable to do that. It's very hard on your mind. It's very hard on your heart. It's very hard on your energy level. You feel you can't get out of bed because your patient in hospital is sick and you have to go see him today and you can't do anything for him. But you learn to be nice to yourself also.
All right, I'm going to open it up to the floor. So if anyone has any questions, feel free to unmute, raise your hand, or just send it into the chat. We have one question in the chat. What advice do you have for a new medical student who doesn't know where to specialize in yet, and how did you know where you wanted to specialize in?
Okay. So for a new medical student, what I would say is, you have the world in front of you. Just do one thing. Go to every lecture. Go to every case presentation. The good thing about medical colleges is you will have these grand rounds that are happening. So sometimes you'll get this email about a grand round from somebody from NIH who's going to talk about genetics of cystic fibrosis. Go there. And just open yourself. In the first 2 years, don't make a decision. Third year, when you have learned all the systems, you are out of the stress of the first 2 years, in your third year is when you start thinking about two main things. Do I want to go into a surgical area or non-surgical area? If you want to go into a surgical area, do I want to do OBGYN? Do I want to do surgery? Do I want to do ophthalmology? Do I want to do orthopedics? If non-surgical, do I want to do pediatrics? Do I want to do medicine, family medicine? So third year, you make that decision, the first half of 6 months of it, and then you start focusing on it. I see so many times in the first year, people are trying to decide what they want to do. And I am so glad that, number one, I didn't do that. But even when I came in, because at that time, most of us didn't think of fellowships. Most of us deciding internal medicine or general surgery. Those were the two big ones. because then you could decide where you wanted to go after that. I'm glad I kept myself open, because there were times I wanted to be the cancer doctor, except I cried too much with my patients. I was thinking of psychiatry. I cried at home all the time in my psychiatry rotation. I was thinking, do I want to do pediatrics? And then I said, no, I don't. My little children will be so unhappy, the peds patients. So I wanted to have an adult population that I can talk to. Then once I decided I want to do internal medicine, then I decided that I wanted one where I wanted to be even more connected with my patients and do chronic disease management. So first year, new med student, don't even think about it at this time. Explore everything. If somebody calls you up and says, you're doing a rotation in the clinic and the doctor in orthopedics says, oh, this is an interesting case, we should write it up. You say, I'm going to write it up, and you write it up, okay? But first 2 years, everything is open to you. The other thing is medicine is very different now. By the time you all graduate, genetics will be a field that would be fabulous. Pathology, we don't think of pathology very much, but pathology is going to be a fabulous field. So keep your mind open, go explore, go to these lectures that are sometimes done randomly. You know, an expert from Canada is coming, or the World Health Organization chief is coming. Go to those places and attend those lectures. Okay?
And the second part of that question is, can you give any random tips to survive medical school?
So I always, when I was at Aachen, it is, I would say, equal to in hardship to beyond equal to the medical schools here. And the reason for that is we were expected to do fabulous. Like, it was a very demanding atmosphere, very competitive atmosphere. But the good thing that happened was, number one, I decided I will not compete with other medical students. I think that made me survive, because by nature I was very competitive. In high school, I was competitive. In sports, I wanted to win everything. Every exam, I wanted to be the top scoring person. And after medical school, I became that person again. But in medical school, I made a conscious decision. I said, I will not compete in medical school. And that brought down my concern, my anxiety level a lot. The second thing was I always prepped ahead. So again, because I always wanted to perform better, I said, I'm going to be the best I can be. So when we were started, let's say hematology, which by the way was my weakest link, and I knew it was very hard for me, I would read before the lecture, which it's totally up to you if you want to do it. But you know, the question was, how did I survive a very tough medical school? So I would read before, but I wouldn't read in depth. I would only read it to where, when the person is talking about it, I had an idea what they were talking. And then I came up with this rule. Don't quote me on it, but I call it the 3-time rule. And I tried to convince my children, but they were not convinced, but maybe you will be convinced, which basically means to understand something, you first do the pre-reading, then you do the reading of the material, and then you teach it to another person. So my poor sisters, the older sisters that I was showing you, they had a hard time, because I would catch them and I would say, I want to tell you how hematopoiesis happens. And I would just write it on a paper and tell them how it's done. Now, they were not even listening to me, but that is what I call my 3 things rule. So if you can apply it, if you think it will work for you, it really brought my stress level down. I was not the top student in my class. but I was definitely one of the happier students in class. And I never said that I don't like med school because I loved it. I never said I don't like my residency because I enjoyed it. Again, same thing in residency. So be prepared ahead of time. If something is going to be extra tough for you, identify it ahead of time. But if you identify it during the rotation and then seek help. So for me, I already had people around me that were going through med school, and we worked as what we called a group. So I had a group of med students. There were 4 of us, and we did what we called group study all the time. I don't know how you all go through med school, but we did this thing called group study because I think it really helps to study as a group. It makes you feel less isolated. I think the biggest problem in med school is people get anxious, then they get discouraged. And then because of that, their grades fall, and then it adds to the stress. It becomes a vicious cycle. I have seen young people leave medical school because they say we can't handle this. So you find a mechanism that works for you. And this was the mechanism that worked for me. Okay.
All right, does anyone else have any questions for Dr. Uzma? Yeah, go ahead, Isa.
Hi, thank you so much for your presentation. It was a very fascinating lecture on endocrinology and especially your journey through medicine. My question is, what was your experience like moving from Pakistan to the University of Missouri, right?
Yeah.
And like, was it hard to adapt to the change in environment and like the clinical culture?
Yes. Thank you very much. I was almost hoping you would not ask this question, but I'm glad you asked it. So what happened was I graduated in November of 1991. I got married in April of 1992, and I came to the US in June of 1992. I had never been to America or Europe, so no Western countries for me before. I had never worn anything other than a shalwar kameez, because now girls in Pakistan will wear jeans and t-shirts, but at that time we did not. So when I first came here, I actually wore a shalwar kameez. I did not wear trousers till after my residency. In my residency, I wore a shalwar kameez, and it was accepted by the program director. I know now I see people wearing like long shirts and the trousers, and I think it's accepted. But I was very conscious about it. The other thing was I did not wear any makeup. I just never had. And a nurse, about 3 months into my experience in the hospital, a nurse came up to me and she took me to a room and said, Dr. Khan, it's a pleasure having you here, but we need to, have a little bit of makeup and a little bit of lipstick on. And I said, okay. Now, again, I was a very submissive person, just new in the United States. If it was me now, I would say I only put lipstick on for a presentation today. I don't wear makeup. I just go around just without makeup. But at that time, I was very conscious of it. So I started wearing a lipstick. I had a friend who sold Avon. So that was one experience. The other experience was the food I cooked was Pakistani food. And I have always cooked. We still eat the same food. I always cook at home. But I didn't realize it until somebody sort of mentioned to me that the fabric absorbs the what we call khushbu, the fragrance of the food, but to them it was not a fragrance. And it seemed like a patient had noted it. So after that, I was very careful. I kept my work clothes separate. I made sure I washed them. Tide has a very strong smell that can wash out any other smell. So I made sure of all of that stuff. Um, and it's funny that nobody ever said anything about me being a Muslim woman, but those were the things that were pointed out to me. I also had an episode where people assumed, so this was when I had already done my fellowship, and somebody wanted me to do something which I had said I will not do. And it was a professional thing that they were wanting me to do, and I said, I can't do it. And they thought they could go to my husband and have him convince me to do it. So this person went to my husband and said, your wife says she cannot do this. And my husband says, if she says she can do it, she is not going to do it. And I think that's because my husband knew me very well. He knows that if I'm not going to do it, I'm not going to do it. He does not try to convince me to do things that I don't want to do. He's always been very supportive of things I wanted to do. So that was an interesting experience, just making the assumption that because I'm from Pakistan, my husband can tell me what to do. And then again, these were some things that happened. I found I was perfectly fine living in America. I had no problems with America. But those were the few little things. My English was not very good at that time. But I worked in the VA. And the funny thing is, if you ever go to a VA hospital, it's my favorite place. We had these older veterans there. And I had to speak very slowly because they almost always had some hearing problems. So I always tell people I learned to speak English at the VA hospital because I learned to speak slowly. And they would, anything I said, they would always say, oh, you have an accent. Where are you from? And I would tell them I'm from Pakistan. They would say, oh, yes, I was in Burma or I was in India. I even had a few that went to Karachi because they were veterans and they were so open to a person from another country. So that was a very positive experience for me. But other than those few small, minor negative experiences, I haven't had any. But now I do try when I have a young girl that has just come from Pakistan. I always tell them, you have to learn to stand up for yourself. And we're not talking about Muslim women at this time, but as a woman in medicine, I have had it to where people have tried to, because I tend to be soft spoken, I don't scream, I have a very, monotonous type of speaking pattern. I've had people try to like shout me down, at least at one meeting, and I would not let that happen. And you can do that by just being very firm where you are and not showing your expression. Just sitting right there. That person can go shout as much as they want. You just sit back. And then when I talked, people listened. So I learned very early on, you don't have to be loud. You don't have to shout. You can be yourself and people will respect you. But yeah, those two things I still remember, the lipstick and the clothes. And they didn't complain about the shalwar kameez, it was the smell of the food that the patient did not like. Okay.
Thank you.
Okay. Now, one thing I want to share with you is I do not tend to shake hands very much. I will do it if I'm in a very professional setting and the other person extends their hand. But most people that know me, they know I don't shake hands. They also know that I don't hug. Generally, it's very rarely that I would give a hug to a person other than my family member. And people have respected that. They have respected these boundaries forever. There is one very, very nice doctor. His name is William Nicholas. He is my professor, and he was my professor in my fellowship. And he's the one non-family gentleman. And by the way, he is my father's age, that gave me a hug. And I appreciated it because he came up when I was graduating and he said, Uzma, I would like to give you a hug to show you how much I love and respect you. And this is a gentleman that's my father's age. And I welcomed his hug and I respected him too for that. When you go in practice as a woman, there will be hurdles for you, but you will find a group of people around you that will really make you a better person. And some of them will be men, some of them will be women. Then, as a Muslim woman, I am quite sure if you are the one that has indicated very clear sentiments, boundaries, and respect, whether it's a male patient that needs a genital exam, a colleague, or some person at a random place, they will respect you. There may be one or two people that may not respect, but those people you will find anywhere. It's not just healthcare, you'll find them anywhere. But my experience has really been very positive, and I have had a very fulfilling career in my life.
All right, thank you, Dr. Uzma. Does anyone else have any more questions, comments for Dr. Uzma? Okay, that brings us to the end of our event. Thank you so much, Dr. Uzma, for your presentation. And before we end, I wanted to mention that Dr. Uzma is one of our Flash mentors here at MWM. So if you want to connect with her more, ask more questions and hear more about her experience, I'm going to send the application in the chat. So feel free to fill that out and we can get you connected to her. And yeah, that brings us towards the end of the event. I wanted to mention that everyone here is eligible to get a certificate of completion. Basically like a, 1 hour type of thing that you can document. I know a lot of pre-health students and pre-med students want experience. And so this is good to include in your resume and stuff like that. So I will send in the link for that. It is just a short quiz, a couple of questions on everything that was mentioned in this presentation and about Dr. Uzma's journey to medicine. So if you fill this out, we can send you a certificate at the end afterwards.
And I'll just say one thing, Alina, thank you all so much. Feel free to call, email, whatever is the format that works for you. And I really wish you the best. I think women are designed for healthcare. I think when we talk about a perfect design by Allah, I think women are designed for healthcare. And you all have the passion for it, otherwise you wouldn't be here. Anything in healthcare doesn't have to be a doctor or an endocrinologist, which, by the way, I think is fabulous. Anything in healthcare would be lovely for you, so fulfilling. And when you retire 30 years later from 1992 to 2022, you're almost thinking, this was the best thing that happened to me. Okay. So I wish you all the best. Feel free to reach out anytime. Alina has sent the contact information. Okay. Thank you so much for being here today.
All right, thank you everyone, and feel free to visit our Instagram and everything. We're going to have more opportunities like this, more events, and inshallah next month we'll have another session like this with another professional. All right, thank you guys. Assalamu alaikum.
Thank you. Have a good evening.
Thank you.